Hi, I'm Gary White for Central Kentucky Television at Springview Hospital in Lebanon. I'm here with Dr. Bart Dawson and with Truman Taylor, who are both going to tell us a little bit about the pulmonary rehab unit that has recently started here at Springview Hospital. At the beginning of the year, if you recall, we were here with Dr. Dawson and Mr. Taylor talking about the cardiac rehab, right? But now we have a pulmonary rehab that just opened up. And tell us a little about what pulmonary rehab and what it encompasses.
Well, the pulmonary rehab program at most facilities, including Springview, it's somewhat similar to what we had talked about with cardiac rehab. You can think of it as monitored exercise in order to benefit the patient's symptoms and quality of life. So if you look at pulmonary rehab specifically, we have patients that certainly have some degree of a chronic lung disease, which we all know about COPD and asthma. But there's certainly much less common pulmonary diseases that also qualify a patient for pulmonary rehab. So the qualifications for pulmonary rehab are that a patient has dyspnea, which is basically shortness of breath, uncomfortable breathing in somewhat of a chronic fashion, and a pulmonary diagnosis. So a COPD, asthma, chest wall deformity, sarcoidosis, cystic fibrosis, things of this nature, and there's a whole host of diagnoses that would qualify a patient. But the basics for those listening would be a chronic lung disease and shortness of breath. Okay.
Now, with the pulmonary rehab that's here, they can either get a referral from a doctor or self-refer if they feel that it would be beneficial to them, correct?
Absolutely, as long as they meet the diagnostic criteria, and a lot of times that's established by the pulmonary function testing that is offered really anywhere, and certainly here at Springview, where you can measure the patient's pulmonary capacity, and that's done with a test called spirometry. And that establishes the numbers of this. You know, what is their percent lung function? How much air can they move? And that, along with their diagnosis, really makes them a candidate. But the patients certainly, if they've had that testing in the previous year before coming in for rehab, can refer themselves, and then any primary care doctor, pulmonologist, cardiologist can refer their own patient for the program.
Okay. Now, you oversee the program here, correct? And we see some of the equipment behind us. What is involved with the rehab program?
The rehab program strengthens the upper part of their body and helps them improve the activities of daily living. But it's very similar to that of cardiac rehab. Therefore, we use the same room and facility.
Okay. So you see they'll come in and possibly go through a cycle on the bike or with the other equipment that's here, correct?
That's correct.
Now, how long usually does the program last?
It's usually 36 visits. Sometimes it can be less, but usually not more than 36 visits.
Okay. Now, who would you recommend contacting the hospital about this program?
Well, really any patient, certainly the biggest population of patients out there, certainly in Kentucky, are going to be those who have emphysema, COPD, chronic asthma. Those patients certainly, if they're more short of breath than they would like to be, or if they're struggling with dyspnea, and they have not been through pulmonary rehab before, I highly recommend a referral, be sent for the pulmonary rehab program. And this has been shown to benefit certainly a patient's symptoms, their functional capacity, how far they can walk without stopping because of being short of breath, and their general quality of life. And there's hard data out there to support the use of pulmonary rehab. But really those are the patients, dyspneic, short of breath patients who have the chronic pulmonary ailment. That's an automatic referral really right there.
Now, if there's somebody, for instance, like myself, who has asthma with allergies, will this help prevent them from having to use the medicine, or will you kind of go with what they're already doing?
Well, a lot of this, it doesn't change the pathology. It doesn't change the disease they have, whether it be asthma or COPD, but it allows the patients to become more fit. It allows their lungs to be a bit more efficient with the way that they work and recruit the full capacity of their lungs that they have. And a lot of folks, if they don't exercise, not only because they're afraid to, or if they just don't know how to, or they don't go through the right type of program, they never really make any progress in improving their overall fitness. So while a pulmonary rehab program isn't going to cure your asthma, it's not going to cure your COPD, it may make your lung function and your overall fitness level to the point where you feel much better and are more functional. And that's really the point of the program. We also offer educational opportunities for the patient, not only to understand their disease process more, but understand their medication use, how to use oxygen, breathing techniques that can help certain pulmonary patients breathe more efficiently and handle exacerbations better.
Okay. Now you're saying too about some educational programs, so they can come in and learn a little bit more about what's going on with their bodies as well.
That's correct. With each exercise, there's an educational component that takes place with each visit. So they will talk to them about, eating the right food, stopping smoking, things that will benefit their breathing.
Now, we're saying that this is a new program here for Springview that has just opened up in May, but it helps with the community because they don't have to travel as far to get these kind of benefits.
That's correct. Some people that have these chronic conditions do not feel well enough to travel to Louisville or Lexington, and they can get the same type of treatment here.
Now, if somebody's thinking about possibly doing this, what would you say to recommend them to come and visit Springview?
Well, number one, you talk to your physician. If you don't know whether you have chronic lung disease, but you know that you wheeze a lot, or you smoke, or you have a history of breathing difficulty, then the first thing to do is talk to your physician and be tested and see if your lung function's okay. And if it isn't, certainly pulmonary rehab may help, but certainly either by contacting your physician, contacting the hospital. You can get hooked up with the folks here at Springview and potentially enroll in the program. But yeah, I highly recommend it, and feel like it's a good thing for the community and definitely something that is available for a lot of patients out there.
And it is something too that insurance may cover as well, correct?
That's correct. Most commercial insurances and Medicare cover it.
Okay. Well, again, we've been talking with Dr. Dawson and Mr. Taylor about the pulmonary rehab that is now available at Springview Hospital in Lebanon. You can call the hospital and set up an appointment to be reviewed to see if you qualify for the program, or talk to your general physician and have them recommend you.